All right, hello, my name is Professor Kreitziger. I am a nursing instructor here at Bryant and Stratton College, and I would like to demonstrate for you our head-to-toe exam, also known as the Bedside Assessment. This is for our fundamentals students, so I will be talking through it as I do it, and I would like to introduce our wonderful work-study student here, John Pantillo, who has agreed to be our patient, and I really appreciate you doing that, so thank you. So first off, I'd like to show you, I put all my stuff out so that for one reason, so that I'm all prepared, and for another reason, so I don't forget to do anything during the exam. I've got all my stuff out. I've taken a look at the Braden scale and the Morse scale so that I can be sure to collect all the data that will be necessary for those, because I'll need to reference those in my note. So I would like to, do my knock-knock, provide publicity, or you should be providing privacy for your patient. Gel in, I already introduced myself, and John, can you tell me your last name and your date of birth for me?
Last name Pantillo, date of birth 4/10/80.
Great. So I'd like to demonstrate our head-to-toe exam. So I thank you in advance for doing that. It should take between probably about 15 to 20 minutes. So is that okay?
Sure.
Great. Okay, so now when you do this on your med-surg patients, you will be noting if there's any isolation. So John here is on general precautions because he's a member of the community, but if your patient is on isolation, you'll need to know that. And are there any safety concerns? And obviously John's a bed lib, so no safety concerns. And I know that he doesn't use a walker or cane or any assistive device or anything like that. And what brings you here today?
Just a general assessment, and maybe you can check my blood pressure. I have a history of hypertension.
Okay, so history of hypertension. So any other health history?
No.
Okay, great. And I will be doing vital signs as part of this. So actually, I could get that out of the way already. I will not be actually demonstrating that for time reasons, but you'll need to do a full set of vitals. So your two-step blood pressure, temperature, pulse ox, of course, and pain on a 1 to 10 scale.
0, no pain.
Great. Okay, and heart rate too, but I'll catch that during the cardiac exam. So now your general survey is something that you're always going to be doing on every patient. So I see that John's in no acute distress here. He's not struggling to breathe at all, not using any accessory muscles. His mood, affect, and appearance are exactly what I would expect. He's dressed appropriately, hygiene is good. He's responding appropriately to my questions and stuff. So I could ask about orientation, like where we are right now.
Bryant Stratton College.
And what's the date?
November 4th, 2015.
Okay, thank you. I had to think about that for a second too. And of course, always remember, any unexpected or any unusual answer to any of your questions always requires some follow-up. So remember, for fundamentals, we learned focused body system assessment. We did, respiratory, cardiac, all that stuff in a very focused and detailed manner. So for this, everything is going to be a little bit abbreviated version, but if I find anything that is out of the ordinary, I would go into that in more depth. For instance, mental status, which I don't have to, but I do need to ask you about sleep. So how do you sleep at night?
I sleep pretty well, 6 to 7 hours uninterrupted.
I wish I got that much sleep. That would be awesome. So that's acceptable. And see, I already did vital signs. I would ask for your height and weight for my note. I don't need to do that right now, but I would need to find out your height and weight. And actually, having your patient get up and go to the scale would be an okay time to do your get up and go assessment. Look at your balance and your Romberg and your gait belt and that, but I will do that later. So I just would also like to point out, now's a perfect time for that, that there's no particular order that you need to do the assessment in. It could be any order that makes sense to you and an order that also makes sense to your patient. So if you want to do it by body systems, or if you want to do it by part of the body, whatever way that you have practiced, have a good flow, and that makes sense, you can do that. But I would like to do our neuro exam first. Actually, this is perfect while you're sitting up. So I note that you're wearing glasses. That's part of your note. So would you please take those off? I'm going to shine a flashlight into your eyes. So just watch me, and I'm watching for Perla. Remember, the pupils equal, round, and if I was going to do accommodated to light, I would have him, or excuse me, accommodated to distance and close vision, I would have him look across the room. So right now I'm just going to be able to chart Pearl, P-E-R-R-L. And I'm going to assess your upper body strength. I'm going to have you squeeze my hands here. And can you pull against me here? Okay, and push against me. Great, and I'll have you lie back. I'll do your lower body strength. Thanks for going along with all this stuff.
Sure.
So I will have you push up with your feet against my hands and push down. Great. And I notice that there's no edema here. I'm gonna also check his pulses. So the dorsalis pedis are +2. Posterior tibial are +2 as well. You know, temperature's excellent, so it looks like you have really good circulation. So I try to do all the feet stuff together. That makes sense to me. That's how I kind of remember it. And I can also gel after touching feet, which you should always do as well. So back to the face. See, I see that his face is symmetrical. Like when you smile at me, the corners of your mouth rise symmetrically. You don't have any facial droop, and you don't have any lid droop or anything like that. And do you have any trouble swallowing at all?
No.
Okay, great. And you'll notice that I have taken one of our cotton tip swabs, and I like to prepare it a little bit by kind of fluffing it out to make the difference between soft and sharp sensation stand out a little bit. And another good thing to do, and I actually learned this from a student, so keep in mind, you know, we're always learning as well. I'm going to have you hold out your hand. So what I'd like to do is touch you randomly in different parts of your body. So when I touch you like this, that's going to be the sharp sensation. And when I touch you like that, it's going to be the soft sensation.
Okay.
Okay, so what I'd like to do is have you close your eyes and let me know what you're feeling, when, and where.
Sharp left leg.
Okay.
Soft left arm. Soft right arm. Soft left arm.
Trick you. Actually, I shouldn't skip an extremity, sorry.
Right arm soft.
Great, thank you. So I think that's it for neuro. Did I miss anything?
I don't believe so.
Okay, I'm trying not to miss anything. That's why I'm looking at my notes here. So what I'd like to do next is respiratory, and I'm going to have you sit up again. So keep in mind, you always want your patient to be comfortable. You don't want to ask them to move around a ton. I asked them to lay down and sit up. That probably wasn't the best way. But another thing is, keep in mind your patient might get cold. You know, if you have a really modest patient, you want to always consider modesty and, you know, covering as much as possible. Only expose the portions of the body that you really need to. So, you know, you don't want to unduly have your patient do a bunch of stuff that is uncomfortable for them. So I'm going to do respiratory. You'll remember for a focused respiratory assessment, we did a lot of deep breaths. That could make your patient dizzy. So let me know if you feel dizzy at all.
Okay.
Okay. And do you smoke at all?
No.
Okay. Any shortness of breath ever?
No.
Okay. Try to ask your review of systems questions along with each. So in my intercostal spaces, I'm going to listen here with the diaphragm. Take one deep breath for me. Great, thank you. Going side to side, always compare sides. Slow deep breath. Okay. And one more. Good. You feeling okay?
Yeah.
Good. Yeah, just let me know. Deep breath. Okay. So I'll just do 6 on the front here. If I hear anything like an adventitious sound or something diminished, I'm going to take more listens in that area, pay attention to, you know, is it inspiratory, expiratory, is it, you know, like a crackle, is it like a wheeze? So using my nursing critical thinking, if I need to explore a system further, then I will. Otherwise, I can just do the abbreviated assessment. So, you know, just keep that in mind. You're always thinking of your patient's history, like what do I need to assess further based on that? Like you mentioned that you had a history of hypertension, so I might focus more on your cardiac, okay? Because, you know, I'm assuming that you take your medication if some was prescribed. But if you didn't, you know, untreated hypertension can lead to heart problems. So I'm going to focus on that a little bit more for you in particular. So our 5 areas over the precordium that we're going to listen to. Remember your second intercostal space for your aortic. I'm going to listen to 1 lub dub in each landmark here. Second intercostal space. Here on my mitral. Erb's point. 4th is tricuspid. And my mitral here on the 5th intercostal space over the midclavicular line. So I should be hearing S1, S2. If I hear anything else, Is it systolic? Is it diastolic? You know, what does that sound like? So diaphragm will pick up the higher pitch sounds. The bell will pick up some lower pitch sounds. So I'm going to make sure to go back over those same areas with that in the same way. Any chest pain ever?
No.
Okay. You said you don't get short of breath?
No.
Good, okay. Any numbness or tingling anywhere in your body? Okay. Before I forget, I want to check for pulse deficit. So remember how we do that with the apical and the radial. I don't have to listen for a whole minute. I can just listen with my diaphragm over the apex of the heart here and compare it with the radial. So what I'm feeling for is there adequate perfusion. Are all the beats that I'm hearing over his heart perfusing all the way to the periphery? Which they are. And, you know, again, critical thinking. Do I need to actually explore that further? No, I don't. Not for this guy. He's good. Now, speaking of being short of breath, we do have this device here that if you find on your patient that they have some diminished bases, if they have some, you know, a need to take slow, deep breaths and cough, for instance, after surgery, I would teach you how to use the incentive spirometer with a mouthpiece on it, of course. So what you need to do with this is 10 times every hour, do a slow, deep breath in, kind of like sucking through a straw, like if you had a thick milkshake, you're gonna take a deep breath in and then exhale out of it. So the idea is that your slow, deep breath will make this part float really slowly and kind of really gently under the vest. And you also want this to rise as high as possible because this part is your lung capacity. Okay, we want you to inhale fully so that you don't get pneumonia. Okay, and does that make sense?
Yeah.
Okay. In real life, I would have you demonstrate that back to me so I know that you know how to do it. Really useful tool. So remember, I mentioned the Braden scale before, so you want to capture all the pieces that go along with that. So your nutritional status, how's your appetite?
Great.
Yeah? Okay. You get fruits and vegetables every day?
I try.
Okay. All right. You know, your his skin is warm, dry, and intact, and there's no shear. Like I said, he's up ad lib. So all those pieces that go along with the Braden scale. And that kind of really leads me into, you can put your shirt back on if you want.
Oh, sure.
I'll have you lift it up for the abdominal part. I'll have you lay down for that too. I don't want you to get cold.
Thanks. Oh, I lay down now?
For the abdominal part. I'll have you lay down for that too. I don't want you to get cold.
Thanks. Oh, I lay down now?
Yes, please.
Okay.
Yeah, so I'll do the abdominal assessment, and you'll notice that I'm actually standing on his left side. Normally we have you do it standing on the right, but just because of the way we're recording this. So remember, for our abdominal, we're doing inspect, auscultate, and palpate in that order. So the contour looks good. You know, I don't see any bulges or any abnormal pulsations or anything like that. So I will take a listen. And when was your last bowel movement, John?
Last night, like 10 o'clock.
Okay, was it normal for you?
Mm-hmm.
Okay, you said your appetite was good. Any nausea, vomiting?
No.
Good. Okay. I'm just gonna take a listen here. Hopefully my stethoscope is warm enough for you. So listen in all 4 quadrants here. All sounds are normal. They're not hyper or hypoactive at all. So we'll just lightly palpate. Let me know if anything's tender
Okay.
at all. Remember the order that we do those in. We always want to follow along with the way your digestion normally goes. Nothing tender? Yeah, okay. So part 2 here. While I was doing the abdomen assessment, that always leads me right into my GU assessment. So, John, is your urination normal, typical for you?
Yeah.
Okay, when's the last time you urinated?
This morning, 7 o'clock.
Okay, so a couple hours ago. Any burning or discomfort or pain, dark urine, anything
No.
like that?
No.
Cool. All right. So lastly, I would like to look for your gait, or assess your gait, I should say. So I'll have you sit up yet again. Normally, obviously, I would not be doing a gait belt on you, but I just need to demonstrate that I know how to do it for the assessment here. So I'll slip this around you. And, you know, I think it's also a good idea for us to experience what we put our patients through, you know, when we put them in some vulnerable situations, and, you know, what does that really feel like? So it's good to try these things out, too. So on the count of 3, I'll have you stand up. So 1, 2, 3. Okay, and if I were going to assess your balance, which I know I don't need to, but I would do the Romberg test, which I'm gonna test to see if you're kind of swaying or anything like that, like I'm looking at your balance. All right, well, I'm gonna have you sit back down here after I walked you across the room, right? So thanks, John. I'd really like to thank you for going through all this with us. I'm gonna tidy up my room. Remember, safety is paramount. And also consider that you need to complete this in 1/2 hour. Do your note right away because you don't wanna forget anything. And let us know if you have any questions.